The proposed bill, which is subject to changes as it faces scrutiny by a parliamentary health committee, calls for a 6-month jail term for failure to comply with vaccination requirements during disease outbreaks. Attempts by Ugandan officials in recent months to enforce limited mandates have been unsuccessful. A vaccine requirement for people using public transport faced opposition from operators, and bars have returned to business after an extended lockdown without strict adherence to pandemic-era rules. Uganda's health minister announced in January that more than 400,000 vaccine doses were to be destroyed after they expired before being used. That's considerably low set to a government that has administered only about 12.7 million doses and whose goal is to inoculate at least half of its 44 million people. President Yoweri Museveni had warned last year that local officials would be held accountable for any expired doses, putting pressure on them to administer substantial batches of vaccines that often arrived with looming expiration dates. Now it appears authorities will try to codify vaccine mandates. Odoi, who chairs the Parliamentary Committee on Human Rights, has said that the government has a political responsibility to enforce vaccine mandates in a country with a weak health system and facing widespread vaccine hesitancy.